ways, and this is part of the report on handicap and disabilities and the problem with healthcare that we have in Vermont. One thing we want to achieve is universal healthcare. Can I ask you a question? Why do you do this?
You asking me?
Yes. Why do you go through all the trouble to keep all this equipment at your home and in...
Because it's a needed service in the area.
You're basically telling me that people just can't afford to go out and get this
Right.
stuff.
People cannot afford to go to these medical places and buy or rent this stuff. It's too expensive.
Now, do you think the Green Mountain Care Board that the legislature and the governor set up is doing a good job so that folks can afford health care?
I don't think so. Health care is sky high. It's out of reach. You can't afford to be sick. And that's one reason it gives me a reason to continue, which I'd rather not, but somebody's got to do it. I guess it's going to be me.
Thank you.
Till I drop dead.
My healthcare coverage ended once I left college. I grew up under the umbrella of my parents' policy. The first few jobs that I had outside of school were with larger Fortune 500 companies, and they all provided health coverage. When I started to get to the point in my career where I wanted to branch out on my own as an entrepreneur, there always was that looming issue of healthcare coverage. At some point, I decided to just take the risk. I didn't want to be into a job that I didn't want just for the health coverage, so I just decided, let's roll the dice. I'm young and healthy, and let's just see if we can go for a while without coverage. Turns out, I ended up going at least 10 years, a decade, without having any type of health insurance and just rolling the dice.
I understand that you have health insurance, but if you didn't have health insurance and you had a major healthcare crisis, or if somebody you know in your family has one, would you be able to pay the bills?
No.
And if it was a serious thing and you really had to have it done, what kind of things would you probably have to give up in order to take care of your health?
My home, my apartment, my car, life.
Recently you were hospitalized, and when you got out you had a prescription. Can you tell me about when you went to the pharmacy, what happened next?
Well, it needed to have a pre-authorization, and because it didn't for this specific pharmacy, the cost of the prescription for 3 weeks would have been $1,499.99, and without the medication I would not have gotten better.
Now, if you would have had to buy that on your own, you probably wouldn't have been able to afford it. So would you have to go without things in order to?
Yeah, I'd have to go without basically everything.
Thank you.
You're welcome.
The problem of getting medicine, that it's just not readily available, especially like your problem.
Exactly. It's It's not readily available because Medicaid and Medicare will not cover it.
So what do you do then?
There's not a whole heck of a lot you can do. You got to do without. And for the cost of the medication that I need, $900 a month just for a month's supply, I can't afford that. I wouldn't be able to buy food. I wouldn't be able to keep my apartment. I wouldn't be able to pay all my other bills that I've got. So I'd be basically out homeless again.
Thank you, Darren.
The eyes in the country are on Vermont, and if we get this right, it will mean the patients that we as healthcare professionals see every day will have the access that they haven't had in the past. And every day, nurses, other healthcare professionals in our hospital, we see them with conditions and diseases progressed to such a state that wouldn't have occurred if they had been able to access health care sooner. We see patients whose infections are worse because they didn't get to a provider, a nurse practitioner, or a PA, or a physician, because they didn't have the money, or they were afraid that their condition was so bad that it would bankrupt them and they might lose their home. But still, eventually, they got so sick they had to come to the hospital. We see patients with chronic conditions like diabetes who have other issues, other patients with chronic diseases that worsen or have other conditions related to the disease that crop up because they haven't been able to get health care.